Today's story is about the Oguchi Hospital inpatient murder case. Oguchi Hospital, located in Yokohama, Kanagawa Prefecture, Japan, is a nursing hospital sought after by elderly patients or severely immobile patients. However, in the fall of 2016, an unusual phenomenon began here. Every Saturday, a slightly higher number of patients than usual would pass away. Of course, since the hospital had many elderly and severely ill patients, the hospital staff considered deaths to be normal. So initially, the medical staff and officials did not notice anything unusual. However, especially in that year, a significant number of patients passed away at Oguchi Hospital. From July 1st to September 20th in 2016, just under 3 months, a staggering 48 patients passed away at the hospital. What was even stranger was that a considerable number of deceased patients were those staying on the fourth floor of Oguchi Hospital. The fourth floor could accommodate a total of 35 patients, yet 48 patients died here in 3 months, which was quite suspicious. Not only that, but there were occasional reports in Yokohama City, where the hospital was located, about strange occurrences at Oguchi Hospital. The complaints were about strange incidents happening at the hospital. There were reports of medical needles constantly going missing and records of certain patients disappearing. These reports were somewhat related to medical services and were complaints. Additionally, the reports included strange details, such as needles found in nurse pouches. The suspicions continued to grow. Amidst these ongoing reports, one day a nurse at Oguchi Hospital urgently called a doctor. According to her, while she was trying to replace a patient's IV solution, she accidentally dropped the infusion bag, and at that moment, the liquid inside the bag started bubbling suddenly. She noted that the IV solution was normal, but the sudden bubbling was strange, so she hurriedly reported it to the doctor. The hospital immediately requested a police investigation, and the results confirmed the presence of a substance called diametol in the infusion bags. Diametol is essentially a detergent used in laundry detergents. Therefore, it was a substance that should never be in IV solutions, as it could be fatal if it entered the body, causing stress on the heart and potentially leading to death within as little as 2 hours. At that time, the hospital was using a cleaning agent containing diametol to clean medical instruments. The police suspected that someone had mixed this detergent into the IV solutions with the intention of administering it to patients. The police promptly closed the hospital and began investigating the IV bags. The investigation seemed very serious, as out of the 50 IV bags stored, a shocking 10 were found to contain diametol. The police believed that the culprit injected the detergent into the infusion bags using a thin needle and then administered it to patients. They checked the death records of patients and found that an 88-year-old male patient died on September 20th, and upon autopsy, diametol was found in his body. 4 days before him, another patient in his 80s died under similar circumstances, and 6 days before that, a 70-year-old woman also died showing similar symptoms. Hospital officials also mentioned that the number of deaths in the hospital had increased rapidly recently. Initially, they were seeing 1 death per day, then it gradually increased to 2 or 3 deaths per day, and eventually there were days when as many as 5 patients died. The police began a thorough investigation to find the culprit. However, from the police's perspective, finding the suspect was not easy because diametol was frequently used in hospitals for disinfection, making it too easy for anyone to administer it to IV bags if they wanted. However, due to the nature of nursing hospitals, it was common for patients to pass away, so autopsies were rarely conducted after a patient's death, and the families did not feel the need for autopsies either. Therefore, the families faced difficulties in accurately identifying not only the perpetrator, but also the victim, as they often proceeded directly to the funeral without autopsies. Consequently, the police decided to conduct autopsies on the deceased who had not yet had their funerals. Initially, diametol was detected in the first autopsy of an elderly patient. When the police conducted autopsies on the deceased who had not yet had their funerals, diamital was also found in the body of that deceased. The police were convinced that the culprit was inside the hospital. They came up with an idea. The police investigated the clothing of all the staff working at the hospital. If diamethol had been used as a detergent in a normal manner, it would have been limited to the cuffs and pants of the clothes, but if it had been added to the IV solutions, it could be found elsewhere or in a different form. So, the police took away the staff's clothing and examined each one. They found suspicious traces on the uniform of one nurse. A significant amount of diamethol was detected in the nurse's uniform pocket. The police immediately named the nurse as a suspect. The nurse was Ayumi Kuboki, 31 years old. She had started working at Oguchi Hospital in May 2015 and was a nurse working on the problematic fourth-floor ward. However, it was difficult to conclude that she was the culprit based solely on this, so the police focused on obtaining more concrete evidence. Fortunately, blood left by a deceased 70-year-old woman before her death was still at the hospital. The police conducted a diamital reaction test on this blood, and the result was positive. The police investigated the nurses who administered IV solutions to this woman, and Kuboki was confirmed to have administered it. In addition, there were several other pieces of evidence. First, colleagues testified that patients' conditions deteriorated rapidly after Kuboki checked on them. Also, CCTV footage showed Kuboki wandering around the ward with an infusion bag in a suspicious manner. With this evidence secured, the police began questioning Kuboki. Unexpectedly, she did not try to hide her crime at all. She confessed that she had injected diamethol into the IV solutions of at least 20 patients. When asked why she murdered the patients, she said it was because she was tired of families coming and asking why their loved ones died. She found it too troublesome to answer each time, so she injected diamethol into the IV solutions just before leaving work, hoping the patients would die while she wasn't there. She also revealed another reason for her decision to commit murder, which was due to conflicts with her fellow nurses. In the past, a patient under her care had died, and a colleague blamed her, saying it was all her fault. After experiencing this incident, she didn't want to be criticized by colleagues or anyone else anymore. To avoid this, she made a rule that patients should not die during her shift. So since the dying patients were going to die anyway, she started committing the crime to make them die when she wasn't around. Kuboki was eventually arrested and stood trial for the murder of 3 people. However, during the investigation, she admitted to killing over 20 people, making it difficult to uncover everything. Most of the bodies were cremated, making it impossible to objectively determine how many she actually killed. Nevertheless, during the trial, Kuboki's lawyer began to argue for her innocence. The lawyer claimed that she suffered from depression, schizophrenia, and mild intellectual disability. The judge, considering that she had worked as a nurse, believed she had sufficient cognitive abilities. In November 2021, Kuboki was sentenced to life imprisonment for the 3 murders and multiple counts of murder. The verdict was unsatisfactory for both the prosecutors and the defense attorneys, who are currently appealing the sentence to the Tokyo High Court. Since the incident, Oguchi Hospital has been renamed Yokohama Hajime Hospital.